We initiated active surveillance for low-risk papillary thyroid microcarcinomas in 1993 and reported its safety and lower incidences of unfavorable events compared to immediate surgery. Now, active surveillance is becoming popular. Proper selection of patients is necessary for successful active surveillance. Risk assessment with ultrasound features is an important factor in the selection. Important features are whether tumor is solitary or multiple, and the location of the tumor in relation to the thyroid capsule, the running course of the recurrent laryngeal nerves, and trachea. Of course, lymph node status should be evaluated carefully. With these features, the risk of active surveillance is classified as ideal, appropriate, or inappropriate. For inappropriate patients, surgical resection should be considered. Patients with a solitary tumor surrounded by normal thyroid tissue are ideal for active surveillance. Patients with multiple tumors or bilateral tumors within the thyroid are appropriate for active surveillance. Tumors attaching or possibly invading the anterior or lateral thyroid capsule carry minimal risk of disease progression and are classified as appropriate. Ultrasound cannot reveal recurrent laryngeal nerves. We should be careful for the possibility of invasion to the nerves. The risk is evaluated whether normal thyroid tissue is present in the direction of the recurrent laryngeal nerve. If not close, ideal. If normal rim is present, appropriate. If normal rim is not present, inappropriate. Surgery should be recommended. The left recurrent laryngeal nerves runs along the tracheoesophageal group as shown here. However, the right recurrent laryngeal nerve runs obliquely, so the risk of tumors located near the posterior capsule of the right thyroid lobe should be carefully evaluated. The risk of tracheal invasion is evaluated with the angle formed between the tumor and the trachea. If the angles are acute, it is classified as appropriate, while the angles are obtuse, it is classified as inappropriate, and we should recommend surgery. This is an ideal case of a solitary tumor surrounded by thyroid tissue. Multiple tumors within the thyroid are shown here. Our bilateral tumors are classified as appropriate. Tumors with possible invasion to anterior or lateral thyroid capsule are classified as appropriate. In this patient, the tumor is located near the recurrent laryngeal nerve. However, there is a normal thyroid rim in the direction of the recurrent laryngeal nerve, thus classified as appropriate. This tumor protrudes from the posterior capsule of the right thyroid lobe, where the recurrent laryngeal nerve may run, thus classified as inappropriate. This tumor is touching the trachea. The angles formed by the tumor and the trachea are acute, thus classified as appropriate. In this patient, the angle between the tumor and the trachea is obtuse. Dorsal portion is unclear. In such cases, a CT scan may provide more information. This is an inappropriate case, and surgery was performed. The tumor was shaved off the trachea. Of course, lymph node status should be carefully evaluated because papillary carcinoma can metastasize to the regional lymph node as shown here. This figure shows the summary of ultrasonographic risk assessment. Thank you for taking this session.